My name is Oma Holloway. I am chair of the board for Imani House. Imani House has been in this community for over 20 years. But Imani House had to face head-on the challenge of Ebola. Imani House has run a clinic for 25 years in a small countryside outside of Monrovia. For 25 years, the Imani House Clinic has provided much needed mental health services to individuals on the countryside of Monrovia, and had to face the Ebola crisis head on. When it was very silent in this country, they didn't even make the front page all the time about what was going on in West Africa. You heard about it, but it was happening in West Africa. It didn't have an impact. Sister BC was writing letters. She was trying to get people to understand what was going on, to pay attention, to get some publicity for it, so that we could deal with this head on. The clinic itself, educating the health providers there on how to protect themselves and really know what the signs were. And we had to deal with it head on with staff members who, two staff members that actually got the Ebola virus and had to shut down the clinic for a couple of weeks. But the staff there wanted to keep it open, and we done everything to make sure that it was disinfected. And we are now scheduled to reopen the clinic again. But it did speak to that we needed lots of resources to keep it open and stay a resource. There are not enough beds in Liberia to deal with this crisis. But I'm not the expert, but I'm a huge supporter of what's going on. As chair, we are committed, and we are truly supportive of Sister Brixi's work here in Liberia and also here in Brooklyn. So I just wanted to give greetings from Sister BC to you, and thank you for this opportunity so that we can highlight what we're doing here and hopefully get you more engaged in supporting our efforts as well as what's happening globally.
I met BC back in 1990 when the Liberian Civil War was at its beginning, at the inception of the war. And I actually met her in New York at the Africa America Institute. And at that time, she had come back to the States with her children, having immigrated to Liberia several years prior to that. And she was in the process of trying to bring attention to the crisis in Liberia, the devastation of the war, the lack of the facilities, health facilities, and all of those things. And so, fast tracking, they established this clinic because of the necessity of providing health care, which was not their initial intention. The initial intention was to provide education and just basic services to educate and upgrade people's lives. So they started this clinic, and it's really a clinic that they have expanded, they have built upon it, and it's in an area called Brewerville, which is about a 30-minute driving distance from central Monrovia, and is in a semi-rural community where the community is not very densely populated, but there is a fair number of people, inhabitants in that particular community. I was in Liberia in April, and there were only 5 Ebola cases then, and 1 death. And I came back to the States in May. And I went back to Liberia in August, and by then there were over 1,000 Ebola cases, and there were about 500 deaths from Ebola just in that short period of time. There were no cases presented in the month of May, and it was not until June when a Ugandan doctor who had actually been on loan from the Ugandan government to Liberia to provide primary health care at a hospital called Redemption Hospital, which is really quite close to where Imani House has its clinic. In this hospital, Redemption Hospital, a Ugandan doctor and a nurse died of Ebola in the month of June. So they had the first cases presented in March, They had 5 cases in April. They had no reported cases in May. And they had 2 deaths of 2 health workers in a very densely populated area in a public hospital that serviced this entire area. And so the government then had to take note that Ebola actually had hit Monrovia, because before, when it was in the rural part of Liberia, in Lofa County, which is on the border between Guinea and Liberia, that is where Ebola entered Liberia. When a woman who lived on the Guinean side came into Liberia to see her sister on the Liberia side because she was ill. She died there of Ebola. They didn't really know what it was. Her sister and her family decided to go into Monrovia, not knowing what it was. The sister became ill on her way in a taxi with 5 or 6 other people and threw up in the taxi. Could not reach Monrovia because she became too ill. The taxi driver kept her at his house overnight, and the next morning took her to a clinic in Firestone. And subsequent to that, she was at Firestone Hospital, where she was diagnosed with Ebola and died a day later. So we assume that the people who were in that taxi with this woman who went into Monrovia were the initial contacts, because they had been exposed to her vomitus when she vomited in the taxi. So nobody knew who these people were. And then someone presented at Redemption Hospital in June and had Ebola. The nurse and the doctor taking care of her died of Ebola, contracted from her and died. So then other health workers within Redemption Hospital became infected. Imani House continued to keep their clinic open with soliciting supplies, gloves, and the needed things that they had. But because they were not on the front line, in the sense that they were not actually treating patients with Ebola per se, they were not on the list of facilities to get the packages of the personal protective equipment, the PPEs you hear, which are rubberized, they're impenetrable rubber garments that you put on with all the hoods and the goggles and all of that. And so then they had a challenge in providing care to the community in Brewerville. So Imani House lost 2 of their staff to Ebola and had to close down the clinic, because what happens when a facility has people that die of Ebola, the facility has to be closed down. And so Imani House had to be shut down for the required 21-day period. The place had to be sprayed, it had to be shut down, and everything in it had to be decontaminated. And what it means is that if they had brought in any patients at any point within this period where this individual manifested symptoms, they had to get rid of it. So Imani House is an outpatient facility. They don't have inpatients. They may keep people overnight for short-term care. But if they had people who were suspected of Ebola, who had sat in the chair, lied on the bed, or whatever, that thing had to be gotten rid of. So the beds, the chairs, whatever, had to be removed before the place was decontaminated, and those things would have to then be also decontaminated and then burned and destroyed or buried. So that is the case, that is what they found themselves in. That was the situation that they found themselves in. And so BC had reached out to me when I was before I went to Liberia. I was able to get the Assistant Minister of Health to have solar panels installed on top of their facility, because they were operating during the daytime and having electricity. Electricity is a challenge in Liberia since the war. So they did not have electricity. And without the solar panels, they could only stay opened up until 4 o'clock or something during the day, opening early and closing early. but with the solar panels, they were able to stay open a little bit longer and provide the much needed care that they were providing to the facility in Buruga. Basically, that's it in a nutshell. Ebola hit Imani House. Imani House had to shut down. BC has been stressed out trying to find a way to reopen it. Her husband just returned to Liberia a week or so ago, and they're planning to reopen it, but they're looking to get the much needed supplies. They really will need to have the protective equipment. Well, the resources would include monies for them to be able to provide the kinds of programs that they want to provide. And the other thing is, the supplies. Infection control and prevention is a critical thing in preventing disease. I'm in public health, my area of expertise is in disease prevention. And so you have to have stringent infection control measures in place. Now, what they would need in a clinic like Imani House is to institute these kinds of infection control measures. And in order to do that, they will have to have the proper supplies to teach people how to use these supplies and to have them available so that they don't run out when there is an emergency situation like it has happened with Ebola. So definitely money is always needed, but if any of you in any capacity can come up with literature for anti-stigma, stigmatization, because in Liberia, I don't know if any of you know that, but there are almost 3,000 survivors of Ebola. So everybody is not dying of Ebola. A considerable number of people have died, but they have almost 3,000 people, and they're forming a survivors network. So one of the things that we are helping them to do is to come up with these anti-stigma literature or information fact sheets, because stigmatization is a big thing. So you had Ebola and you survived Ebola, but then how do you reintegrate into your system? And from talking to BC, I think that that's one of the things that she would like to engage in. So how do you teach people within the community to embrace people from within the community who have had Ebola and have them reintegrate? That's another thing. So education, anti-stigma education, literature. In that particular part where the clinic is, a lot of the people are illiterate, they cannot read or write, so you don't want any fancy, sophisticated things. You need to have a lot of graphics. So for those who are able to do graphic designs, you can actually, people relate very well to pictures. You can draw things, do graphic illustrations on how you prevent disease, infection prevention kind of thing. And those are the kinds of, some of the things that you could probably use to educate them. But resources, money, supplies, and anti-stigma literature.
Thank you. I'm going to pitch this over to the chairperson. Thank you, Doctor.
Thank you, Doctor. But if you look at, there's a fact sheet, which I'm very grateful that it shows where you can make a donation through Global Giving. You can go on Imani House's website, which will give you videos of the clinic, information on where you can make a direct donation. Sister BC has been instrumental if you would like to collect supplies. There's a list of recommended supplies that we are requesting, that's disinfectant wipes, gloves, those type of things that might be easy for a school or a class to take on as a project to get those donations. We will help. You could drop them off at Imani House's office, and we will make sure that they get to the clinic. We have a couple of the board members. Sister BC's husband, Mahmoud, is down there to reopen the clinic, but we have another board member, Mary Zigbu, who is also in Liberia right now. She has family and extended family that has been directly affected by the Ebola virus, but is also a huge organizer and advocate. And volunteers. Volunteers are always helpful. We've had many people that have served as interns going to Liberia, but being a volunteer at Imani House can help us with packaging, can help us with creating informational guides that may be better through pictures that can, for young people that would like to send encouraging letters to other young people in Liberia. There are many different ways that we can be supportive of the work that Imani House is doing and the work that's being done at the clinic as we reopen. But education has always been fundamental education and organizing has been the core of Imani House, and we want to keep that going. So there are many different ways, which is outlined in some of the information that you received this evening, that you can get involved, that you can support Imani House. We look for grant writers. We're always going after funding. That is the hallmark of any nonprofit, is looking for funding. So I'm very happy to see the councilman here, because discretionary funding is we have local programs, local programs that are going on, but we also want to make that connection that we live in a global society. It's not just about what's happening over there or what's happening here. We are all connected. So, there are many different ways that you can do it, and we have wonderful staff members that would help, generate, support any ideas that you may have on how that may have that can really move what work we need to do forward.
I'd like to throw something in at this point, and that is that Imani House needs to be in the federal pipeline. That's what they need, because money is getting ready to flow with regard to the Ebola crisis, and they are part of what I would call first-line triage units that dot the country. They don't provide direct medical service, but they let you know that you need it, and they pass you on to the next one. And every person who is sick is not sick with Ebola. There are other illnesses that are going on that also need to be addressed. So if the people here who can move the mountain, we would ask that you start working on moving the mountain. And they're not the only ones, and that conversation can occur at another place. But I just want to, because this is not going to go away. This is a long-term, long haul. The good news coming out of Liberia is the number of cases have begun to drop. That is the good news. But the bad news is the cases in Sierra Leone have started going up. I read this stuff all day, every day. And I am saying to you that this is the 21st century plague. And it has to be addressed in terms of containment, education, and dealing with the symptoms as soon as the person realizes that this can happen. I asked Bees the other day, I said, because it's not entirely true that they don't provide medical assistance. I said, what do you do when somebody comes to you with the symptom of Ebola? She says, we start treating them right away. I said, well, what do you do? She says, whatever they're losing, we give it back. If they're losing water, we give them water. If they're losing food, we give them food. We start treating their symptoms in that regard. And they have been able to. And I was reading today in Lancet that that's in fact what people are doing, and they are encouraging people to do that. And there are other kinds of prescriptive ways that people are doing that are off the charts. They're not on the main drag, but they are working, because Africans are inventive. They're going to find a way to do something about this situation. So I just wanted to add that in. Okay. Any other questions? Yes, sir.
Hi, my name is Philippe, as Lisa was saying. Beyond just schools, there is also the various effort. I was thinking it's a good thing Brad is here. The whole notion, of course, of all of us writing and advocacy and so forth. Excellent. That is very important. I was looking at your list, and one of the things I noticed was missing, and tell me if that's correct in the case of Liberia, is the importance of communication in terms of radio. I've always wondered about, I understand in a lot of hospitals, things we take for granted here, gloves and all the other stuff that hospitals do not have around the world, which is crucial. But the point of getting information out to people in rural areas, and I often thought, whether it's through funding from here or donations from here, whether radios that uses batteries or crank up, solar cell radios, or whether the Gates Foundations and all these others, because I know in terms of rural communities and developing countries, sometimes information doesn't get to the various points, and people come up with their own ideas as to what they think is happening. And then, of course, the mistrust spreads, and they go, oh, this is not real. So is that something that in Liberia that could be a crucial issue? Because I think radio is inexpensive.
Well, that's actually the distrust of the government, the distrust of the health professionals, the distrust of the aid agencies. That has been happening since the inception of this epidemic.
Yeah.
But yes, you're right with the radio, because of the electricity issue.
Yeah.
Not everybody has access to electricity.
Yeah, exactly.
So every household practically has a radio, and they're mainly battery operated radios. And now that the cell phone has been introduced, most people in the rural populations have radios, and most of the cell phones have some kind of a radio on it, and so they're using those who don't have actual radios use their cell phones to get information. And so they have several radio stations that have a very wide transmission area. And so they're able to, and they have community radios also in all of these different areas. So the community radio actually is the one that is supposed to disseminate information directly to the community, and then they have the national stations that are all over, national radio stations.
Are those trustworthy sources for those people? Do they trust the sources?
Well, one of the things that has happened in Liberia is you have an influx, a proliferation of radio stations. So you have a radio station for everybody, and the people have become very vocal. They don't mince words. So you have a lot of talk radios, you have a lot of community radio stations where people can actually get the information directed at particular populations. So it does exist. Now, if you want to send them radios, the transistor radio, but they're mostly battery operated because of the electricity issue in.
Yeah, we're talking about solar.
Most people don't have solar. Most people don't have solar because it's expensive to have solar installations.
On the radios themselves, they're getting inexpensive. The radios, the crank ones, and some. Yeah, that's what we meant. The crank ones, the one that if you don't have access to battery or electricity. I grew up in developing countries, so I understand the tenuous situation of electricity. I get that, but I was just wondering, and as she was adding trusted radio sources, because even here in this country we have radio sources in which we listen to the information that they give, and we're like, wow, some people believe this. So we're wondering in terms of spreading, stopping the spread of diseases in so many different ways. One of them, of course, is one of what to do and how to do it, and if people trust some of those radio sources that are giving them the information.
Yeah. So the radio stations exist, as I said before. They have a proliferation of radio stations and newspapers in Liberia, and there is a radio station for every population. I mean, people they just target certain groups of people. So there are all these radio stations that are not the mainstream radio, that are disseminating messages that other people don't want to get. So they do exist.
I think if you have an idea about the radio, then I think that conversation ought to be taken off, because that's going to take some thinking. That's a good idea, okay? And I would just encourage you to move forward with that idea. Other questions or comments? Yes, ma'am.
First, I wanted to say thank you, Dr. Stone. It was very, very insightful to hear what you had to say. And I also wanted to thank you for giving me that. Thank you, Ms. Holloway. My question is twofold. I was hearing that the 21 days for the Ebola virus, that's more like due diligence than it could be shorter. So I'm trying to understand if you could just kind of talk to what the reason for 21 days is, and then if you also have any idea of where this virus has traveled from before Liberia.
Well, I said at the beginning of my talk that the virus entered Liberia from Guinea. The countries have very porous borders because, when the British, the French, and all these other people went to Africa and decided to divide it up, they just created these arbitrary boundaries. But it was like one big country. And so the divisions that created Guinea and Sierra Leone and Liberia, families live on all sides of these borders. So this woman in Guinea, her whole family was living in Guinea, but her sister lived on the Liberia side. So she came over to Liberia to visit to her sister when she got sick, and she died there and was diagnosed as having had Ebola. That's how Ebola entered Liberia, but it started in Guinea.
So you're saying the origin of it was Guinea or?
In West Africa.
Oh, okay.
In West Africa, it started in Guinea. The origin of Ebola was in Zaire, which is now called the Democratic Republic of the Congo, back in, some people say as far as 1972,
Yeah.
when they first had people presenting with all the symptoms that they now have identified as Ebola today.
Hence
But
the
in
name.
1976 is when the name Ebola was given to this disease. And Ebola is the name of a river in the region where it started, in Zaire, now Democratic Republic of Congo. Ebola is a river, and because people around that river bank were the ones manifesting with this deadly disease, when Peter Piot, Dr. Peter Piot and his colleague went and were doing all of the analysis and came up with a name for this disease, the symptoms that constitute this disease, they named it after the river, Ebola, where these people had initially come, manifested the disease. So that's the origin of it, and I told you how it entered Liberia. So your question was?
It's the 21 days.
The 21 days, okay. The incubation period from exposure being if you come in contact with somebody who has Ebola, who is actually exhibiting symptoms, who is vomiting, who has a very high fever and is sweating profusely. Now, having a fever and being in a room with somebody doesn't make you contagious. The fever has to be a fever over 101 point something, and you have to be sweating profusely. And the reason for that is because the sweat is considered a body fluid. And Ebola being a hemorrhagic fever, you can perspire, and through your pores, the pores of your skin, you can bleed. So you can produce blood, you can sweat blood, and that is infectious. So
That's where the virus is.
the most significant thing for you to know here is that from the day of exposure to someone who is infected or exposure to the dead body of someone who has died of Ebola, because the dead body is equally infectious. Okay, and that's how a lot of people in West Africa have become infected, by preparing the dead for burial. Because you have to consider two things here. Number one, you lose somebody dies.
You love them. You want to
You're
close them.
grieving for that individual. And then you're told, don't touch them. If people have had a very hard time understanding that, what do you mean? I've lost my mother, I've lost my sister, I've lost my whoever, and I'm not able to touch them, and I'm not able to prepare them for burial, you know, the particular rites that they perform. And so that's one of the ways that a lot of people in rural Liberia and in rural Sierra Leone became infected with Ebola. So, but from the day of exposure to an infected individual or an infected dead body, people who are going to become ill usually become ill on the 2nd to the 8th day. The most common periods of falling ill is day number 2 and day number 8. Some say day number 10, after you've been exposed. However, there have been cases that have manifested symptoms as far along as day 20 or day 19. And therefore, to be on the side of caution, you extend the range to the 21 days, knowing full well that most people will become infected within the first eight days of exposure.
Excuse me, doctor, I'm just letting you know that you are now on the
Yes.
margin of the
Oh,
time.
yes.
that you have
What
to
time?
leave. It is after 5.
Yeah.
5? Okay,
I'm just letting you know.
I'll give you 5 more minutes of my time.
Okay, let me call you and then I'll talk to you. You first. Go ahead.
Related question,
Related to the anti-stigma, is this true once someone has survive, they are immune to future
Yeah, that's what.
infection? And is that part of the education that needs to happen?
Yes, because once you have been infected and recovered, now let me just say what determines recovery. When you have Ebola, you know, after there's no cure, so they treat your symptoms as individualized. The treatment is individualized. Whatever you manifest is what they treat. If you're dehydrated, bleeding, vomiting, whatever, they treat the symptoms. So when you are thought to be recovered or recovering to the point where you have you're coming back to life, they do another blood sample. And if that blood sample is negative of Ebola virus, they wait 72 hours and they do a second blood test. And if you test negative still for Ebola virus, then they declare you Ebola free. Some people even wait for the third sample to declare you Ebola free. And what they're doing in Africa now is they're certifying people to say that if you had Ebola, they give you a certificate that says you have been certified to be Ebola free based on the subsequent test. Because it is the viral load in your system that determines the degree of infection and how sick you will become. The more virus you have in your system, the sicker you will be. Okay, and that's why people in the early stages are not as infectious as they are when they become really ill.
Right, thank you, yes.
Well, just in terms of the 21 days, I read recently that in terms of the virus, I'm asking about this, the virus outside the body, say someone vomits or whatever, that it can't live that long outside the body. And I mean, that was what I read was, only a few hours. So the question is, I mean, even in this country, people are concerned that someone touched something. Well, and that they had to close down the clinic for 21 days, I mean, is that overreaction or is it possible?
Well, it is a standard.
Yes, I understand.
It is a standard
Procedure.
and it's a standard for containment.
Right.
Preventing disease is about containment in order to prevent transmission. So you have to contain it in order to prevent it from being transmitted.
But no one was in the clinic anymore. It was just that someone had been sick in the clinic
What?
and might have sat in the chairs or something, but they were no longer there, and they still had to close down the clinic for 21 days.
Because you don't know.
But
You don't know. So you be proactive and you decontaminate anything because nobody really understands as much about this virus. What is happening in West Africa is unprecedented because it hasn't happened before. Ebola, the difference in West Africa is that it is now in urban centers. Before it was just in the bush. It was in the rural areas where people didn't migrate and where it was sparsely populated. But now they're in the urban centers, in cities and towns, where you're coming in more proximity with other people, and therefore the risk of transmission is greater. So if somebody vomits in the thing and cleans it up, that doesn't mean the virus is dead.
Okay.
But it's also
So you have to be
monitor
cautious about that.
And it's also to monitor the health of the staff members themselves for 21 days.
They had to stay away.
They
That's
had
true.
to stay away
Yes,
too.
because they would be.
Exactly.
They could be infected.
Exactly.
Yeah.
So it's not just for the
Because they have been directly exposed.
Yes.
Right.
In the case of Imani House, they had two of their registrars, the people who do the intake. They were not health professionals.
Right.
They were just supposed to register patients and direct them, triage them, for example. But they took upon themselves to pretend to the community of people who were illiterate because they worked in the clinic that they were health professionals, not knowing what they were doing. And they themselves got contaminated because they were treating people for malaria who actually had Ebola. And those kinds of things you have to be very particular about.
I want to just say something. They were not the only ones who didn't know what was going on.
Yeah.
For quite some time, even medical professionals did not know what was going on because Ebola looks like about 5 different diseases, almost all of which are fatal. Okay? It's until the bleeding, it's from the bleeding from the pause, the nodes, and the other officers began, that they understood this is something different, okay? And I have to say, on behalf of the medical community, I never thought that I would see this kind of connection, but from the third level of medical advice in the country to Geneva to Belgium, they were on it. They were on it. They knew they had something very, very serious, and this was not the time to play with it. Now, if you read the material, you will see that there are problems with the World Health Organization. We won't go there. You will also see that Lancet has written a public letter. I would invite you to go online and look at the public letter, because they are very upset with the slowness of response from, quote unquote, the Western nations, because this is the time for them to have what they call on-site treatment labs operating wherever there is an outbreak, moving these things, because that is part of the containment procedure.
Well, in all fairness, though, I must say this.
Okay.
That the Africans themselves must take responsibility.
Well, of course.
You cannot always expect people from the West and the South and wherever to take care of the problems that are within these countries. In Liberia, the president was advised to seal the borders. She did not. The Minister of Health did not take it seriously, because Ebola was known to occur in rural areas. They did not anticipate that it was going to emerge in Monrovia, the capital, and thereby become the epidemic that it is. But the other thing I must say to you is, in Liberia, for example, since 2006, there has been over $2 billion poured into the healthcare system. So you have to hold people accountable. You cannot just say that the West must go in and build their clinics. Listen, Ebola occurred in Nigeria. The Nigerians, I have you know, did not look to the West to solve their problems. They called on Nigerians. They called on the Nigerian professionals themselves from within their country. They didn't ask Obama to send somebody there. They didn't ask Britain to send somebody there. They did it themselves. So the Africans themselves must handle their own problems. And I get sick and tired all the time of Africans not taking some of the responsibility for their problems and expecting everybody else to solve it for them. We must solve our own problems with the assistance of other people, but we have to be able to tell the truth.
Well, that's true.
And to be able to recognize that we ourselves can solve our own problems. There is no reason why you should have no infrastructure if you had so many billions of dollars poured into a healthcare system in a certain period of time. I was advisor to the chief medical officer. I mean, I actually wrote the Liberian National Health Policy in 2006, 2007. So I know what I'm talking about. Okay?
But
And I've got to go.
she has got to go.
I've got to go.
That doesn't
I mean,
mean
and I'm
that
really sorry. I'll be willing to talk to anybody who wants to get more information. And I'll be willing to do this again. You know, if you can get the people together who want to hear about it in another venue, whatever. Depending, I'm getting ready to go back to Liberia at the end of the month. So if you can do it before then.
Can we contact you?
Well, you have Imani House. That's your contact. That's your point of contact.
Excuse me, I just need to get my...
Okay, let me just say something, and then I'm going to call on you. And that is to say, don't confuse policy with being in the hurricane. You've got a problem that is ongoing, that is immediate, and yes, I understand about these other business, but I also know that the infrastructure, while it is not there, has to be put in place by somebody. Otherwise, we have an explosion, and that is a problem. Yes, ma'am.
First of all, I think this idea of Felipe about radio is phenomenal.
Yeah.
That Imani House, we can get Imani House a transmitter. Because as we know with the climate deniers, a lot of information that goes out is misinformation. And in this situation especially, and we witnessed these folks who thought they were trying to help and made a mess. So that a transmitter that goes to the local community that can put out, and that's feasible as a project for our community to sponsor. To get a transmitter, to get solar powered radios, so that the folks know, since they're trustworthy, that that's good information. Second is that aside from treatment and prevention, I'm interested in research. Where, and I don't know whether this group has that the answer to this, but where are the centers of research on this? I read Laurie Garrett's book, The Coming Plague, which was written in 1994 when she said Ebola is the next international epidemic. And she wrote the whole mystery story, as she did the mystery story of AIDS, and how that started out, and all the politics and the researchers and who got credit and who didn't. So this is not a surprise. If Laurie Garrett, who is a science writer for multiple reputable publications, had it in her book, written in 94 and published in 97, which I encourage everybody to read, The Coming Plague. But I think we need to fund also, look for the places where there's research going on about what the nature of this beast, this tiny microbial beast is, and how we can get to the under it, you know, not only keep it from spreading this way, but really kill the fucker, if you'll excuse my
I'm gonna give precedent to Brad.
Thank you, Matt.
Yes,
Brad Land.
and because he has to go. So just everybody hold on. You've got the floor, sir.
Thank you. First, let me say a big thank you to Imani House, to BC in her absence, and to Dr. Holloway and to Liesl for bringing us together. It's a great group of neighbors, and to the doctor. You know, what I'm reflecting on is obviously in the moment when there was a panic in New York, we could have moved mountains, you know, and there was an enormous attention. It reminded me of, you know, those days either after the hurricane or after 9/11, when you just saw all New Yorkers come together and raise millions of dollars in an instant, really do things in a very powerful way. And but unfortunately, before that, when it's in Africa, not something that we're thinking about, and even it's sort of extraordinary how quickly, of course, we're all so happy that Dr. Spencer is doing better, but it's almost like it's just off the minds of New Yorkers. And so, you know, whether because just out of compassion for thousands of people.
I'm sorry, Brad, the doctor is asking for her coat. Who knows
Her
where
coat?
it is?
Behind the table, behind the table in front of you.
Muriel, do you know where her
That's
coat
behind
is?
you.
Okay.
And we don't have to disturb that to find a coat. Go ahead.
You know, whether for compassion for the thousands of people in West Africa, or whether out of a recognition that it can't be stopped globally unless it's stopped where it is. We have to do more to, you know, make sure that our neighbors continue to pay attention. So I went and looked. I saw that I think it was like, I don't know, 7,000 or 8,000 people opened and read the email that I sent out just about what was going on around Ebola here. And I certainly will send those people another email letting them know about the work Imani House is doing and asking that they stay involved, at least make a contribution or consider getting involved in one of the other ways you're talking about here. So thank you very much for doing this. And of course, my heart goes out to the Imani House partners in Liberia. And I'm glad to hear that clinic is set to open again and be, you know, obviously it's a big, what's needed to confront and really solve the crisis is large, but to be one piece of it is important. So thank you for
Actually, Brad, before you leave, I would like to at least maybe send this question, this thought into you, because you made a very interesting point in the sense of, you know, missing opportunities. And it's too bad that we have to see it as such. Not you're doing, but you recognize it as such in terms of how we operate in any country, not just ours. But sometimes having an illness, a disease, whatever we want to call it, monster, even whatever, it really doesn't matter, with a name that sounds strange to people and they assume that it's far away, it'll never get to us. It's a sad reflection on humanity because they're forgetting history in the terms that an illness that we now call the flu which is just commonplace, no big deal. We get shots for it every year, which kills more people, but most people don't realize it because the name sounds so innocuous. But you know, the flu, whatever. And then before that, it was called the Spanish influenza, even though it started in the United States. But it was interesting to watch how it spread around the country so very quickly and became such a bad epidemic. And we need to learn from those things, that just because something have an interesting or strange name and it seems so far away, that we should not ignore it. Because again, humanity travels very easily, and what you see as someone else's illness may the next day be yours very, very easily. So it's good to pay attention to people who are dying and who are in need everywhere. So perhaps you could send that to your group of 7,000, email guys. Thanks though for coming. Really appreciate it.
Thank you very much. Thanks
Thank
again
you,
for
and thank you so much. Okay, fine. I just want to piggyback on this, which raises another possibility, and that is letters to newspapers, into media, to keep up the interest level on the issue of Ebola. And that's something that anybody with a left or right hand and a piece of paper and a stamp can do. And in terms of getting a groundswell, because that is what moves the mountain, if there are any mountains to be moved. Yes, ma'am, you're going to say something.
Yes, hi. As a person from a third world country, and I happen to be from a country who always has disaster. I'm from Haiti. And I think it's time for the outside world, the supposedly friends of those countries, when an event happens, when there's a disaster, we tend to have people who tend to think they know more than the people living in the country. I don't think we should disregard what the doctor have said. Billions of dollars are put into Africa or Haiti, and they didn't have 30 beds.
Yeah.
Think about it. Yeah. So now for Imani, and I heard the gentleman with the radio question, listen to the people who live there. Listen to what they need. Crank radio, people are not listening. There are tons of radios, all those countries. Radio and talk has been part of our African traditions. Crank radio, people are not listening to crank radio. Right now, in all the countries, I go to Africa, after the earthquake, I spent 6 months living in Haiti, and since then I've been going to Haiti. But it's streaming, everybody is streaming, and if I've been listening, I listen and I read news from Africa, not only because there's Ebola, I've always done it, several times a week. I read newspapers from France, from Africa, from different parts of the world. That's how you get informed, not when something happens, everybody is going crazy and they know best. Now, for the whatever funds we're going to get, and people want willing to hear from this community to Imani House, it's people, lots of streaming is going on in Africa and in third world countries through telephones. And information, people can get information without the crank radio. So whatever limited resource.
As a board member of Imani House, let me assure you how we communicate with the clinic. The clinic itself has its own steering committee, which are representatives of workers at the clinic, the people who have a vested interest who live in the countryside there. I've never been to Liberia. My connection is I've known the work of Imani House. I knew about the clinic in Liberia. I'm not Liberian. I've never been there, but I knew about the great work that Imani House was doing here in Brooklyn. Being a board member, I had to quickly learn when Ebola hit. The advocacy work that BC was doing, she was 24 hours. Her being in the hospital was unfortunate, but it was a foreseen occurrence because she's been this was extremely, as you can tell, personal. And she's an educator, she's an organizer. So, she read everything there was about Ebola. She on the conference calls with the steering committee. Her husband was there for months and months working on the ground, and this still happened. And I think Sister BC is the most cautious, educated woman, and really it is about changing culture in some ways at the clinic. And we still had to face when I said my first Ebola nightmare. I started to read it to see what was happening to families, and then to have to face it with the clinic that we had 2 members that passed away. They had to contain their families for 21 days. Her husband came back. We had to deal with the stigma that he was in Liberia. They did interviews. but Sister BC herself put him on a 21-day quarantine. Now that was before any of the protocols were in place from the governor, from the president. Just out of responsibility, when he got back, 21 days he could not come out until she knew that that was happening. So we are listening. If you look on the list, those were suggestions that we need for the clinic that came from those who were on the ground at the clinic. And we also, one of the major things was the ambulance. We need transportation. That was a huge issue, gas and transportation. That is one of the biggest purposes, that we have our own transportation that we can help transport, because that's an issue on the countryside on how you get people to the treatments that they need in a safe and contained environment. So yes, I agree with you, and we are taking these recommendations based on what our knowledge for the supplies that are needed, but also directly from those that work in the
I'm gonna keep moving, yes.
Sorry,
I'll come back to you, but let me get other people, yes?
So I want to do the pledge.
Oh, okay, well, after him, then you.
I just wanted to say, with respect to any stigma issues or bullying here in the city, I'm with the New York City Commission on Human Rights, as was mentioned before. We, along with other agencies in the city, are working hard to deal with that stigma and bullying. Quite honestly, it is, as council members said and others have said, a large response in response to, I should say, large concern when there's much less medically to be worried about than people are saying and thinking. But I think the greater impact here locally in the city is with African immigrant communities, and particularly from the 3 countries most affected. And we are going to look at situations where people are claiming that they have been prevented, for example, from going into a store because they are or appear to be from, say, Sierra Leone. We are going to look into situations where someone is from, say, Liberia, and they're told, well, no, you can't come in here because you're Liberian and you're going to get me sick. We have 2 complaints that are actively being investigated right now that involve healthcare workers, which obviously vulnerable population, as we've heard here today. But basically these 2 people were told, you can't come to work. Why? Because you're from Nigeria. Well, never mind that that's in a completely different region and the kind of outbreak that's going on. Person allegedly asked, well, why not? Well, because of the Ebola. This, of course, is ridiculous given the medical facts that we know. But these are the kind of things we're going to look into. So I would urge you, if in your work with Imani House or any of the rest of you who are out in the community, if you hear of someone who's on the receiving end of that kind of stigma or bullying, please call 212-306-7450. That's the main number at the Commission on Human Rights. And an appointment will be made for an interview with one of our legal staff. Again, it's 212-306-7450. And you can also find the information on our website. We also have a Facebook page and a Twitter account. So, you know, I can't, as a city employee, directly put into the basket today, but in terms of making people aware of how our agency and the rest of the city is responding to that aspect, certainly be aware of it. And we have a ton of information online. And again, if you think that there is a situation where somebody is being bullied, like that unfortunate situation up in the Bronx, please let us know. And just to add on that, if somebody is subject to some kind of physical abuse, contact local law enforcement. I say that as an ex-prosecutor here in Brooklyn. Please do not wait if there's been some kind of physical confrontation. let criminal law enforcement get involved and do what they're paid to do.
Thank you. And we've got,
212-306-7450.
say it again.
212-306-7450.
Fine, thank you. We've got just a few more minutes, and I'm going to turn the front of this over to Lisa Burns. Lisa, you want to come forward and do
Okay,
your thing?
what I'm gonna do is ask you guys to help me out again, if I could. If the boys would be willing to pass this basket around, and this pledge form, if you haven't got it, I wanted to have a little closing conversation with us, because we did say 4 to 5:30, and we wanted to meet, this one means business, and I head in that direction. So I thought I'll ask you some questions, and the answers are more reflective and short, not your own questions. And as I do, I'd appreciate it if you think about it. If you fill out the pledge form, even if it's not completely filled out, we'll put you in a database and we'll share it with you, the rest of you. And say, these are concerned neighbors. And we'll share it with Imani House. If you don't want your name shared with anyone but Imani House, that's okay too, you could mark it. But if you don't, it's very easy to walk in and walk out, and we won't be able to form a community around these concerns. So I ask you to take the pledge form seriously, even if you don't know exactly how you might contribute.
If we have your information, we will keep you updated on, the activities that are going on at the 282, the work that Imani House is doing, some of the many interviews and articles with Sister BC about Ebola as the progress of the clinic. We will constantly keep you updated on what's going on. There's also the Global Giving Fund and Imani House's website if you would like to get information or make a direct donation. One more.
You have a website?
There's a website, yes. It's a really nice
so all
website.
This information
all
is
of this
available
information
to me
is
if I
on,
want
and
to
we
get
exactly,
on
and
the
we keep
website.
and we
Good.
keep it updated. That is always available to you too. We have a Facebook page, Twitter. We have a social media presence. And a lot done by volunteers. So this is another way that you can get involved. We even have a rap song from Hip Hop Saves Lives. That is a wonderful video that they did to really demonstrate the work that Imani House has done. So we have many different ways to communicate and get out the word.
I want to just add one other thing quickly, and that is Act Local, Think Global is also a hub where if you really want to incubate an idea, that's where I would suggest that you begin to have the contact. We are in close communication, so it's not like you're not talking to the right hand versus left hand situation. I think the radio thing is a really good idea, but it has to be thought through.
Oh no, don't dwell on it.
I'm not dwelling, I'm telling you. I think the letter writing thing is a good idea, but let's think it through. And there may be other things that in time you will come up with, so I'm just letting you know that, yes.
Right, and one of the things I'm thinking about is really it's about a shift from whatever we have been thinking and doing and caring with to partnership. That's what I think we're suggesting. In the winter, we're going to bring up and bring together some people who have partnerships with self-help groups in Haiti. I mean, we could go all the way around the world, but also partnerships with public housing, tenant associations, as Imani House has here. But just the big shift is about what if I saw this group as a part of my family, as my neighbor, what would I bring to their front door? What resource would I share, like this former prosecutor? And that's the difference, because it's the invisibility of the grassroots groups that's the cruelty, to me, in gentrifying neighborhoods. The person who's going to be our next Attorney General lives near Kim, on your block. It's moving to Washington. And a lot of people are moving not on up,
And I would
out of the block.
encourage you to support.
I need to say, just a second, Oma. I wanted to ask you a couple of questions as you pass this around. If you want to contribute now, just put some money in the basket. But really what we want is that name. And yes, it's okay. I'm giving you my email information.
We'll take all you have to give.
Laura's got a question here.
Yes.
Do you prefer money versus donations, or is it whatever somebody wants to do? What's your preference?
Whatever someone wants to do. I mean, funding is always important. It's, it's easier to liquidate. It's easier to, to decide where the areas and ongoing. However, we take supplies. One of the ways that people can donate is consider being board members. That's something that you can really give back and be a huge resource, and really looking at your own network to maybe do, fundraising, but to also look at how do we expand our programming, how do we expand our message and get the word out about what we do. And, community-based organizations, especially ones like Imani House, we're always looking for good board members, which that's your time. That may be some of your resources. But it also gives you an opportunity to think long-term on how you can support and grow the organization, but also learn more about what's going on and be a real visible force. You may have resources of schools that might have interns, or churches that may have, opportunities to send someone down to the clinic to be hands-on on the ground, bringing technical resources. So there are many different ways, but yes, funding is, donations are great, but donations in money or in supplies, we accept both and are very grateful.
I'll tell you,
Okay, go ahead.
because I do this all the time for my friends in Haiti. One-time donation is great. It's like a good date. But boy, it's nice to get married, So I'm saying, the sense of I give 30% of my guest house fees, so, to Neges Foundation, and that builds a whole base of 500 guests now who see themselves as in some way partnering, but it's ongoing. It's not the one time. So I'd think about it more that way. What could our family, our school do? I'd like to ask you a couple of questions. We got some time.
Well, we may have a couple of minutes, but, go ahead.
Just in terms of 5, as you're filling out these forms and finishing, what struck you about today? Something.
Sister Bisi is not here.
Oh, I'm sorry.
Sorry, yes, I'm supposed to call on her.
Oh, I'm sorry, your turn. Okay, that struck you.
Expected to see Sister Bisi. They say will be, she's in the hospital. But they say we'll be able to
Talk to her on the phone.
We
Those
had
of us who want to
what's
stay.
called technical difficulties.
Okay, so
I can't speak to the technical difficulties, I'm all thumbs, okay?
However, I do have my cell phone, and if you would like to personally contact her, I'm sure she would be more than happy to say to speak with you.
Do you have a question, or you just wanted to greet her?
Yeah.
Do you have a question, or did you just want to greet her?
I will call her later.
Okay, all right, fine. Are we in the process now of collecting these papers? Because we would like you not to leave with the paper in your hand, we would like to have it in the basket. Because that allows us to call you in the future.
Yes, okay.
We have papers that you can take to others.
Yeah,
Your papers, we would like to have yours. Okay. We're pretty much at the closing element of our gathering. You want to say something?
I just wondered if anyone had any closing words listening. Something that struck you, something that you're taking away.
I had a question I wanted to ask the doctor. In terms of supportive care, I wondered if, if good nutrition, or if you're giving fluids, giving like vegetable juice, helps suppress the viral load. Is anybody looking at
Like she says, it's a beginning, a curve, and an end. If in the early stages of contact, you are able to meet symptom to symptom, you have a possibility of recovery. And there are people who have recovered. And there's a brand new blood-to-blood transfusion process that is beginning to occur because of the antibodies that have been built up by people who have had Ebola and who have survived it to people who don't. So that's one of the things you saw here with the blood that came from Tennessee to help this guy here in New York. I mean, so what I'm saying is that new things are being handled all the time. Your question was a very interesting one. Where's the science being done? It's being done all over the world. Wherever because everybody who has any kind of sense understands that nobody is immune from this, and everybody better get on the case. So I want you to know that here in New York, there are centers, CDC would be glad to tell you what sources. I don't know what we can provide to them, but if people are interested, go to Lancers. Lancers has a whole section of about 150 sections on virology. And they are looking at this because this is very serious. This is a very serious situation. Yes. Oh, you had to tell me to shut up?
Yeah. Actually, before she shuts up, I'll add
She's so
one other
kind.
part.
She's so kind.
She said it.
Uh-huh.
No,
I believe we used the phrase, please finish your thought.
Yeah.
Well, no, you don't want me to finish. I thought you want me to be quiet. Were you going to say something and then we're going to close with
Now, the
your
last
comment?
thing I would say, apart from thanks for bringing it all together, and I think we're all going to leave with quite a bit, even though some of us are more informed than others, obviously, and follow this day to day in some form or another. And the other part, of course, is good to have some young people here. It's beautiful to see that, and it would be great to do this more in schools for more young people and encourage them to write. He couldn't be here today, but he's doing a research report on Ebola. She asked me, where's my son? Which I'm waiting for his entire grade to do, and then we want to put together a piece, and we've been trying to figure it out before, and invite Imani House and Doctors Without Border, which we've been in contact with already, and we're even trying to figure out how to bring Helen Cooper to this conversation as someone from Liberia with books that she's written and a recent trip there. The point I was going to make before this was, prior to talking about those who survive and the stigmatization of those, is people not understanding the science that those people are a crucial part of your community and they should be embraced. And so I was glad you mentioned that, because I was sitting there going like, they survived. They are part of being able to help the communities, but understanding the science and spreading the information, whether it's through graphics or any other ways. Radio, whatever. These are people that you should say thank you. These are the people who probably could help you do things in your community because they've survived it that you cannot do because they have a level of immunity. Okay? All righty. Thank you, guys.
Something to Philippe, that 2 other parents from your child's school couldn't come, but have already contacted the Roots community service person. So other parents might be able to contact community
We've been
Roots.
spreading the word, but we want to spread it to some other schools because he's moved on to another school,
Well,
so we embrace him 2 schools.
But the idea of maybe taking a year-long project and doing something in depth. And I want to thank Dora Khan for doing the video, and we can make it available for schools or whatever.
Thank you, everybody,
Thank you
for coming.
very much.
Thank you. Thank you. Thank you.
Thank you, and thanks